Talks over the Biden administration's social spending plan have stalled in the Senate. The Build Back Better plan includes spending to address child care, paid family leave, and climate change. It also provides key reforms to Medicare and prescription drug prices. But the bill faces an uncertain future, and inflation continues to rise as older Americans remain in limbo. For more, let's bring in Bill Sweeney. He is the Senior Vice President of Government Affairs at the American Association of Retired Persons, better known as the AARP. Bill, good to have you. So inflation rose 6.8% in the 12 months ending in November. How is that affecting seniors and those on a fixed income? Are health care and drug prices also rising?
Well, thank you. Inflation is a real issue for our members, for older Americans. But I think when we think about prescription drug prices and the urgency of Congress passing legislation to address the issue of out-of-control drug prices, what we've done is look back at the way that drugs have gone up. They've gone up 2-3 times faster than inflation every single year for more than a dozen years. If you went back and raised milk prices by the same amount that drugs prices have gone up, milk would cost you $13 a gallon at the grocery store. Gas would cost you $12.20 a gallon. So you think about how outraged people would be if that's what they paid at the pump for gas. Well, that's how outraged seniors are about how fast these drug prices are going up and how tired they are of hearing the promises that they're going to do something about lowering their prices, and they still aren't lowered. So they know every time they go to the pharmacy counter to refill their prescriptions that Congress has yet again failed to lower their drug prices. So we're not taking no for an answer. I know today is a rough day for the bill in Congress, but we're not going to take no for an answer. Our 38 million members nationwide are not going to take no for an answer. And so we're going to be continuing to light up those phones into Congress. We're going to continue sending those emails, and our members are going to make sure that Congress listens to them and finally does something to bring these prices down.
So, Bill, really appreciate you talking about the cost of gas or milk, because it does put that into context for all of us. And obviously, retired people on a fixed income, they are very much hurt by this rise in prescription drug costs. But it affects all Americans. Does the AARP have an actual established position on the Build Back Better bill?
Well, we have taken a position on a number of provisions in the bill. I think you mentioned there's a lot of things in the bill that are really, many people think are great things. AARP does not take a position on all of those issues, but we have taken a very strong position in favor of the prescription drug provisions that are in the bill that were passed by the House of Representatives. We're also very supportive of efforts to increase support for home-based care. We know that the vast majority of people want to get the health care they need as they get older in their own homes and in their communities, not in nursing home settings, for example. And so this bill includes a major investment in home-based care. So that's a really big win. There's a number of other provisions, including building more affordable housing. We know that's a real issue for older people who are, again, struggling to make ends meet. And so there's a number of provisions in the bill that we're very supportive of. But the prescription drug issue is the one that really our members have been telling us about for years. It's one of the top things we hear about. And I should also mention the bill includes hearing aids. It includes Medicare coverage for hearing aids, which is a real gap in Medicare coverage right now. So a number of important things for older Americans that are in this bill. And again, so many reasons why Congress should pass this bill just as soon as possible to get relief to people who need it very badly right now.
Bill, what is the most important? Because you laid out several provisions, and we also had on our screen several things that are within the Build Back Better bill that would help seniors, particularly when it comes to prescription drug prices. What is the single most important thing for retired people when it comes to what's in this bill?
Well, I think the most important thing is all of the provisions that help lower their costs. And so I do think that the prescription drug issue is one of the most important things. Older Americans take on average 4 or 5 drugs at a time for conditions that they're managing. People who are living, who are Medicare recipients on the sort of the median income is around $30,000 a year. And so when they're trying to manage 4 or 5 drugs, and some of these drugs can cost $6,000 a year or more, $10,000 a year. And so some of these things are really, really taking a a major they're a major hit on people's bank accounts. But it's not just their financial issues that we're worried about here, because the number one reason that people don't fill prescriptions that their doctors prescribe for them is because they can't afford it. So it's not only an urgent financial issue for seniors, it's also an urgent healthcare issue because people aren't getting the care they need. Prescription drugs don't work if you can't afford to take them. So it's really important that Congress address this. And look, it's a provision that's supported by 85% of Republicans and Democrats. 85% of Republicans and Democrats don't agree the sky is blue. So this is an issue where I've never seen an issue where people all across the spectrum are universally in support of this. And the only place where this is controversial is in pharmaceutical company boardrooms. So I really hope Congress listens to their constituents and gets this bill passed just as soon as possible.
Bill, you make a very persuasive case, but as we just heard from all of our Congress watchers, the Build Back Better plan is unlikely to pass in Congress before the end of the year. So what's going to happen if Congress fails to lower prescription drug prices?
Well, I think one of the big failures here, and it is a failure of Congress if they don't get this done before the end of the year. I will say the House of Representatives has passed the bill, so this is now really in the Senate's pocket. One of the most important provisions in the bill that will help lower prices is called the Inflation-Based Rebate, or the sort of inflation caps. What that means is that anytime a drug company raises the price of their drugs faster than the rate of inflation, they're going to have to pay back the difference back to the government. So it's going to be a real disincentive to see those prices keep going up and up and up faster than inflation. If that doesn't come into effect in January, we expect that drug companies, like they do almost every year, will raise prices again on hundreds of drugs. And so I think that constituents are going to feel that very quickly in January, and they're going to be wondering why they're still paying those prices. So I think that there is a real incentive for Congress to get this done, to get it done quickly. And so if they can't get it done before Christmas or the end of the year, that is disappointing, but I hope that they make it the first thing they do when they come back in January.
All right, Bill Sweeney, thank you very much.
Thank you. It's been great to be with you.